Welcome everyone, and I'm going to talk to you briefly about the GPhC's responsibilities for setting standards for professionals and what this means for you. And I will also provide a brief update on the ongoing work to review the standards for initial education and training for pharmacy technicians. So, the standards are founded on the belief that the attitudes and behaviours of pharmacy professionals are key to improving patient safety and the quality of care. And at their core, these standards emphasise promoting a culture of person centred professionalism. So, the standards were developed from what people expect from pharmacy professionals and reflect what pharmacy professionals told us they expect of themselves and their colleagues. But they also apply to students and trainees like yourself. So, while approaching registration and professional practice, you should consider these standards alongside other relevant documents from your education and training providers. Each of the standards includes an illustrative example, but they're not prescriptive by any means, demonstrating potential ways for you to meet the standards in practice. But there does leave scope for individual adaptation based on your own professional circumstances. Okay, so if you're sometimes like me, it's easier to visualize what professionalism looks like rather than um, being able to describe it. As a professional, there needs to be consistent demonstration of integrity, responsibility, competence, and a commitment to maintaining a level of good practice in one's work. In essence, professionalism builds on the trust and confidence in your abilities and fosters a positive work environment. Our approach focuses on supporting professionalism as we believe that this offers the best protection for patients and the public. We strongly believe that it's the judgment and decisions of registered professionals rather than the strict rules and regulations that truly safeguard patients and the public. There's no set rule book, especially as registrants take on more clinical roles and as technology and practice evolves, you may encounter complex situations that require tough decisions, and this is what being professional is all about. So, here is a scenario for us to consider when applying the standards. Think about the 9 standards for pharmacy professionals and reflect on how you would approach the following situation. All healthcare professionals have a duty of candour, and this is a professional obligation to be open and transparent with patients when something goes wrong during their treatment or care, especially if it results in or could cause harm or distress. No matter the circumstances, your priority must always be the care, safety, and well-being of your patient. Our standards for registered pharmacies require that owners and superintendents enable you to use your professional judgment in the best interest for those who are under your care. It's important to remember that you are accountable not only for your actions, but also for inaction, and sometimes doing nothing can be the wrong decision. Mistakes do happen, and this is where our fitness to practice process comes in. And this is not intended to be punitive, as Jerome will talk to you about, but it's there to protect and safeguard the public and ensure patient safety. Oh, oh my gosh. Sorry, I have a few issues for my slides there. So once you are registered, you'll need to undergo the process of revalidation. And the revalidation is a term used by healthcare professionals to ensure that they're keeping their skills and knowledge up to date and current. This involves undertaking and documenting your learning and developmental activities. So every registered pharmacy professional must undergo revalidation in order to stay on the register. As part of revalidation, you need to complete and submit 4 CPD entries. These records should be relevant and say for the safe and effective practice of your scope of practice. And 2 of these must be planned learning, meaning that you're intentionally enhancing your knowledge or skills. But it's really important to remember that throughout your year, you are going to be consistently learning. So get into the habit of making a note of things that you do. You'll also need to include one peer discussion in your revalidation records, and this is where you actively engage with a peer of your choosing to reflect on your learning and practice. And finally, you'll need to submit a reflective account considering how you align with the chosen standards for pharmacy professionals, which we mentioned earlier. You're going to be required to submit your revalidation annually during your registration renewal through the My GPhC portal. So, what happens to your revalidation records? So, at each cycle, a random selection will be selected for review and to conduct some targeted selections. If your records are selected and you meet the criteria, you won't be chosen for the next 2 years. However, you would still need to complete your revalidation annually. So, why is revalidation important? It provides assurance to the patients and the public that they have trust in the pharmacy professionals and that it's well placed. And this is achieved by ensuring that registrants stay current, reflect and improve, and ensure patient care. There are plenty of resources available on the GPhC website to help support you with completing your revalidation. In particular, the revalidation framework, which sets out everything you need to know and do. There are also examples from the different sectors and roles. Guidance can also be sought from other organisations listed on the screen, but please be aware that this is not an extensive list. So now for a brief update on the ongoing work and review of standards for the initial education and training of pharmacy technicians. The GPhC recently commissioned research in collaboration with the Centre of Pharmacy Workforce Studies to better understand how the 2017 standards for the initial education training of pharmacy technicians has impacted professional practice and whether they adequately prepare pharmacy technicians for their roles. The findings were positive, and 72% of pharmacy technicians felt that they were well prepared for practice. We also identified a significant link between how prepared pharmacy technicians felt and the sector that they trained in. The research further highlighted an interesting trend that many pharmacy technicians were transitioning from training in one sector to practicing in another. Whilst this research shows that the 2017 standards are working well, we recognise the need to keep up with the pace of change, and we must consider evolving factors such as changes in healthcare, shifting professional priorities, and national healthcare goals. We've already conducted a substantial pre-engagement work and there's more to come, and this will include meeting with members of the Pharmacy Technician Accreditation Panel and Learning Outcome Drafting Groups, among others. I would also like to note that our timeline moving forward will be indicative as future decisions will be subject to council approval. So this slide just outlines some of the overarching changes that will also need to be considered in addition to topics arising from the research and stakeholder engagement. And one key one is the recent government-led closed consultation, which is currently under review, which proposed to give pharmacy technicians greater responsibility. And as a result of this consultation, there could be legislative changes to both the Medicines Act and Human Medicines Regulation. And this would allow pharmacy technicians to potentially take primary responsibility for the preparation, dispensing, and supply of medicines without pharmacist supervision. I will now hand you over to Jerome.